The Unfiltered by Jade.
Jade.
Welcome to the Unfiltered by Jade, where we get out of the box and dive into topics that are sidelined. I look forward to entertain, educate, and inspire. Feel free to like, share, subscribe, donate, and make everybody know about this.
Beats by RB Records.
Shopping assistance, your style, your budget. Our services include online and local shopping for individuals and businesses, personal shopping, purchasing of company and office supplies, importing and exporting small packages across Jamaica and worldwide, and helping you find unique gifts and items for all events and occasions. Contact us at 876-919-5195 or shoppingassistance2015@gmail.com. Shopping Assistance, your style, your budget. Welcome back to the Unfiltered by Jade. Today we have with us here Lesley Perez, and she is here to speak with us about mood and anxiety. She is a primary therapist at Discovery Mood and Anxiety, and she is a licensed master social worker. Hi Lesley, how are you?
Hi, good, thanks. How are you?
I'm doing good myself. It's good to have you here today.
Yeah, thanks for having me.
Sure. So I want to talk today about mood and anxiety. All right. So I've gotten many emails or questions about moods and if they're the same thing as having anxiety or they go hand in hand. I think you are the perfect person to share with us about this and give us some clarification.
Sure.
I want you to tell us first, what is mood and anxiety disorder?
Sure, yeah. So, a mood and anxiety disorder, I would say they fall under the same umbrella, right? So the mood disorder, and in my field we use the DSM-5 to classify everything. But the mood disorder is like the overall umbrella of just that includes anxiety, that includes depression, that includes bipolar disorder. But ultimately what it's basically just trying to say is that if you're having problems with like regulating your mood or you're feeling like your mood isn't really the same, that's really what like mood disorders encompass. Okay. And then underneath that is the anxiety piece. So a specific type of mood disorder could be anxiety.
Oh, okay. So the anxiety will come under the mood, basically. Okay.
Yes, that's correct.
Okay. So they can be separated or they can go hand in hand depending on it. Because if you're moody and then because of the moodiness you become anxious. Does it work that way?
Yeah. So oftentimes what we see is if someone's struggling with their mood, it does lead to a lot of anxiety because you get a lot of get very anxious with the fact that, I'm struggling with my mood, I'm struggling with my, depression or whatever. And so it does go hand in hand often.
Okay. First of all, I want to know, when is it that we need to get this checked to make sure we're just not having a bad day or just having a bad week? When is it that we need to check to ensure or to be certain on what exactly is happening with us?
Mm-hmm. So basically, it's when we start feeling as though we can no longer function in our lives, that's when it starts becoming a problem, right? So once it starts interfering with your everyday life, it starts interfering with your hygiene, your chores, your ability to go to work, your ability to go, socialize with friends. When it becomes a problem and it's interfering with your life, that's probably the best, warning sign.
Okay.
That you should probably get some help.
And it's not self-diagnosed?
Yes, correct.
Okay, awesome.
So, what sex is more affected by these and why?
Yeah. So research shows that women are statistically more likely to get affected by a mood and anxiety disorder. However, part of it, part of what we have to see is also the fact that men are also culturally, men are less likely to get help for,
Right,
mood and anxiety,
right,
because it's either just seen culturally as, suck it up, it's
right.
fine, keep
Mm-hmm.
moving. So for that reason, a lot of people do state that the statistics are probably not very accurate because, how many men are out there who probably struggle with this but aren't getting help, and so it's not, we don't have the data for it.
Oh, okay.
Yeah,
Well, that's not good though.
yeah.
We know that we can have men and women. I mean, women more will share and talk about what's happening, but it's not good when we don't have the men sharing and saying these what's happening, because the less help that they get, the more affected they are.
Yeah, absolutely.
What are some of the symptoms that we can look for?
Yeah, so if we're talking about a change in your mood,
Mm-hmm.
I want to speak on two in specific. It'll specific mood, so one of them being anxiety and the other one being depression. If we
Okay.
speak specifically on anxiety, I would say there's a lot of physical symptoms when it comes to anxiety. So you'll notice a lot of physical symptoms such as your heart rate is faster, you're
Okay.
sweating, your stomach hurts. Stomach issues are, I even when I'm anxious, I have a lot of like stomach issues too. So
Okay.
those are
Okay.
big warning signs. Um, and then again, going back to anxiety and how it interferes with your everyday life, you're so anxious that you can't get your work done. You're so anxious that all you want to do is like stay back at home and like lay down and avoid life. When you start noticing that maybe you're avoiding your responsibilities, that's also
Mm-hmm.
a big warning sign.
Okay. And for the depression?
The depression is seen a little bit differently. Oftentimes, warning signs for depression look a little bit more like a person is unable to keep up with their hygiene, keep up with their meals, keep up with their everyday lives. There's definitely a loss of motivation and
Okay.
feelings of hopelessness and helplessness.
Okay. And that would come under the types of mood disorders, right?
Yes.
Okay. Okay. What are the lesser known types of mood disorder? I'm asking because while preparing for it, I was having a conversation and someone said, like when you see people always fidgeting or they start shaking their legs or their hands, is that also signs
Yeah.
that, there's anxiety or there's some mood disorder there?
Yeah. Well, I want to definitely clarify and say that feelings of anxiety are normal. Everybody is going
Oh,
to feel anxious.
okay.
It's actually good that you feel anxious, right? Because we're human beings and a little bit of stress, a little bit of anxiety is good for us. It motivates us to prepare, to get things done. Without anxiety, we probably wouldn't be where we're at today.
Uh-huh.
So if you notice, little things of little symptoms of anxiety, it's not a big deal. You can learn how to manage it, really, and so you can manage it on your own with maybe any type of things that you find that might calm you down. Or if you need that extra assistance, I say why not reach out to a professional and see what they have to offer. But yes, not every little symptom is going to mean that it's a class. It's classified as an anxiety disorder.
Okay, so we look for the bigger symptoms. As you said, you're not able to do your regular duties or operate regularly in
Yeah,
the
yeah.
day.
Once it gets, too much, that's when it would definitely be classified, and that's when maybe you want to definitely seek some professional help. There's also other forms of support that you can receive, whether it's through medication or through coaching or mindfulness meditation.
Okay, all right. So for people at home, to say we have loved ones going through mood disorder or going through anxieties, and it's not just you know every day. It's not an everyday thing, but they're going through this and it becomes a problem now where they have to go to the doctor to get treated. How do we take care or support them?
Yeah, that's a great question. to support a loved one who has any type of mood disorder, any type of anxiety disorder, I think the first step is learning how to just be there for that person and trying to, help them however they need, right? So some people just simply want to have their support system that's there for them, even if you're sitting in the room quiet together. Some people do like to hear encouraging words, inviting them out, let's go here, let's go there. But understanding that, especially with depression, some people aren't going to be able to find the motivation to be able to get themselves out and through that. So simply validating how they feel, or validating that I can only imagine what it is for you to feel that way, and offering your lending ear and say, I'm here if you need help. I'm here if you need to talk about anything. I'm here if you want to just simply chat. But yeah, definitely we use the word validation a lot in my practice. And sometimes that's really all that people want, is to feel seen and heard, that they're struggling through this.
Okay. I know sometimes I think it's easier said than done to actually deal with persons, especially those going through depressions and anxiety.
Mhm.
Because we can validate them every day. But
Mhm.
sometimes they're not coming out of that state. And
Mhm.
it's a bit difficult to even sometimes continue to validate them, especially when you're not seeing an improvement.
Mhm.
So I think this is when we probably say, hey, I think we need to be on medications. So what are some of the treatments that can be used for this? Because I mean, validating alone sometimes it does not help the situation.
Yeah, yeah. No, it definitely is tough, and I think that on the side of guardians or support people to individuals that are suffering with mood anxiety, I often encourage those people to also seek out their own support. Whether it's going to a group where they can talk and vent, because it is hard, and we also want to validate that side too, right?
Mm-hmm.
But in terms of treatment, once we recognize that this individual is really struggling and needs that professional help, there's therapy is definitely recommended.
Mm-hmm.
The most people will say a little bit of medication and psychiatric support is helpful, and a little
Okay.
bit of therapy and counseling support is also helpful. So there's a variety of therapeutic modalities that people use to help support individuals with any type of mood and anxiety.
Mm-hmm.
Um, so it really depends on the individual themselves, but I'm happy to speak further on the specifics of certain modalities.
Because some of them don't want to take their medications. Some of
Mhm.
them don't want to seek therapy, as I say, especially if it's a male, doesn't want to seek therapy. So
Mhm.
in cases like that, how do families support them?
Yeah, yeah. It's really tough when someone is, really stuck in their ways and just, really stuck with their emotions, and they can't seem to get out of this funk. It's really hard for their families to just allow that, right? So a lot
Mm-hmm.
of times family members, guardians, whoever, support systems want to act, right? Everybody wants to just step in and do something. I want to help and support. And so sometimes that does help, right? Being more proactive and saying, okay, I'm going to drive you to your appointment.
Okay.
Or walking through someone step by step in the morning, especially with morning routines, right? Step by step with them and going, okay, first we're going to sit up from your bed. Next, we're going to go to the bathroom and brush your teeth. And next, we're going to do this. And sometimes helping them set up and follow through a structure is
Mm-hmm.
also helpful. But again, there's so much we can do, right?
So
We can't
exactly
physically
right.
force someone
Mm-hmm.
who is in that deep state. And again, if someone starts to become so upset, so sad, so to a point where it turns into maybe it's unsafe, right? Maybe they're not eating, and maybe they're not, absolutely not functioning. At that
Mm-hmm.
point, I definitely would say that seeking that professional support to evaluate whether this person needs to be admitted into a psychiatric
Okay. Okay.
stabilization would be helpful.
Yeah.
Hmm.
That's yeah. Thank you so much for that part. That part, yeah. I think people need to hear that there's so much we can do sometimes, what that means doing it, and it takes patience.
Mhm.
It
Yeah.
takes a lot of patience to deal with
Yeah.
this situation.
Oh,
Um,
absolutely. A lot of patience.
but alas, I mean, it can be helped, and the first step is for persons even to admit that, hey, I have this problem and I need
Mhm.
help.
Yeah.
Sometimes they won't admit it, but that's where support is, and people can help to say, hey, I think you're going through this, let's get checked up.
Yeah. Yeah. Sometimes when someone that you care about reflects something to you and says, "Hey, I've noticed this." Maybe you haven't even noticed it, but let's talk about it. This might be a problem.
Mm-hmm.
Um, and if you need some support, how can I support you? Um, so being a little bit more proactive and more
Yes.
intense in
Mm-hmm.
that way of like, okay, well, tell me exactly what I need to do, or maybe
Mm-hmm.
I'm going to do this. And at the same time, respecting where that person's at too. So it's a balance.
It's a balance. Okay. Okay. Understood. So tell us, Leslie, where is it that we can find you?
So I currently practice in the state of Connecticut.
Mm-hmm.
I live here and practice here. I'm a primary therapist and I primarily work with adolescents from the ages of 12 to 18, although I have had experience working with young adults up to the age of 21.
Okay.
Um, and I'm soon to become a fully licensed practitioner, so in the state, a licensed clinical social worker, and hopefully
Yay.
opening up my private practice soon.
That's right. Yay. Congratulations on that. Oh my God. So thank you so much for being on here and explaining to us and clarifying what some of these anxieties are and some of these disorders, and helping others. I mean, people out there would want to hear. There are many out there who are going through or suffering through anxieties or mood or
Yeah,
depression, especially since the pandemic has started.
yeah, absolutely. Yeah, I mean, thank you for this opportunity. I mean, I hope that it's so important.
Mm-hmm.
And again, I'm a Latina woman, so I also
Yeah.
know culturally
Yes.
it's not as talked about in my
Yes.
culture, and I know in similar Caribbean cultures as well. And so
Yes.
I definitely think it's having the discussion is important. It's a
Yes, it
first
is.
step.
Yes, this is. It's our first step to getting help.
Yep, absolutely.
Most definitely. So thank you again for being on the Unfiltered by Jay. Thank you, listeners, for listening. And we'll be back next week, Tuesday. Thank you.
Bam bam bide, bam bam bide, badu bidi bam bam bide.